Thank you, Etienne. And then I'm asking now someone from the Somali interpretation room to come into the English channel, please. And thank you for that. So again, welcome to this Wednesday meeting. It's been a while since we've seen each other. We took the month of August off, but we are here now, and we kind of want to get this meeting started by hearing from another one of our colleagues, Dr. Matias Valenzuela, who will be giving us a brief update on where we kind of stand here in the county around COVID. So with that, Matias, the floor is yours, my friend.
Oh, great. Thanks, Justin. So, yeah, thanks for being here and happy to be here again. It's been a while. I know when we first started with COVID, I was in these meetings a lot. But now happy to be back, and thanks for all of you who've just continued to be engaged as we address also not just COVID, but other public health issues, especially as we've declared racism a public health crisis. And also, I'm glad to see Genome, our new team member, in this meeting. So what I wanted to just provide is an update around where we are with COVID-19, since it's been a pretty quiet, generally a quiet summer, but things have started to really pick up. And as we head into really the respiratory illness season, which is fall and winter, as we've seen other years, even with Omicron, this is when we tend to see, more challenges in terms of higher numbers and more infections and more hospitalizations. As you can see from here, and this is recent numbers. This is from the numbers that were from last week. You'll see that cases are on the increase, and we still, we're not testing like we used to. So the numbers are actually not always the best. This number is not always the best indicator because many people are doing home tests, or sometimes people aren't doing tests at all. So they don't get reported into the whole public health system. But we also know from hospitalizations and other markers that we are seeing more activity. Fortunately, there have been some variations in terms of the variants, and we have some new variants. But the good news is generally that the vaccine that is now ready and is being distributed, it's the 2023-2024 vaccine, is a very good, generally a good match for the strains and the variants that we're tending to see right now in the community. I think this is really, for us in public health, it's a call to action that it's that time again. And we are moving into this period now in which it's looking more like flu, in the sense that we have a yearly uptick during late summer and then going into the fall and winter. And we've already starting to see the early indications of that happening. And now is also the time to get vaccinated. And just in time, also this month, the FDA approved the new vaccine. It's no longer, the old vaccines really aren't actually going to be used anymore. Those have been taken out of production, and now we have the new vaccine to really be able to address and keep some of these numbers low, so our hospital systems are, able to function. We don't get overwhelmed in terms of hospitalizations. And the challenge here is that we have the triple threat, really, of COVID, flu, and RSV. We are working at Public Health Silicon County to actually create some new dashboards, and the dashboards are going to include not just COVID, but they're actually going to combine also flu and RSV, and those are going to be ready this fall. So hopefully when we show information like this next time, we'll be able to also cover what is happening around the flu and RSV all together, because combined, that's really what is important. If we go to the next slide, also want to reiterate that, and this is kind of small, but just pointing to the fact of just activity that we've been seeing, recently, and what are the communities that are being impacted. And you can see that South King County, as this has been happening throughout, is really where we see some of the biggest impacts from COVID-19. And we see this also around other illnesses and diabetes and other conditions, asthma. It really follows a similar trend. But what I also want to highlight, especially as we're moving into vaccinations, is also more and more the really acute or more serious situations are among the older populations, some 65 to 79 age group, but really the biggest numbers and where we're seeing most of the hospitalizations and subsequently the deaths too are on the 80 plus. So this is why the older population, this will show you just very clearly with what we're seeing now and where we're seeing the biggest impacts. It is on older populations, especially in 80 and over. But once you start getting into 50 and over, much more likely to also have complications. Similarly, and this is a story that we've had from the very beginning of COVID, that some communities and racial communities are being disproportionately impacted. And you can see here that the Native Hawaiian Pacific Islander has the highest rates of hospitalizations. American Indian, Alaska Native is also high. And then you can see also for the Black community, it's 4.6 for the Black community in terms of a hospitalization rate. So this is where we also want to make sure that we're getting, vaccine, and we're really preventing the illness in areas of South County where we're seeing the biggest impacts, and making sure also that our communities of color, Black, Indigenous, are where we are really prioritizing with our efforts and with the vaccination activities that we're doing. If we go to the next slide, and this is also give you a sense of the importance. There's some vaccines, like, let's say, chickenpox or others, that really, measles, that when you get the vaccine, it's, really reduces to close to zero the chance of getting that vaccine. We know with COVID or getting that illness, we know with COVID-19, it is different in the sense that it doesn't prevent you from necessarily, it does prevent the chance of getting infected. But most importantly, it really reduces hospitalizations, and that's the most important factor. And you can see here that among those people who are either up to date on their vaccination or vaccinated, but not completely up to date, the much lower rates of hospitalizations that they have. And then you can see how much more common it is among the non-vaccinated to be hospitalized. So I think it just drives home for us the importance of vaccination. And it's still very relevant. And with the new vaccine that's come out for the 2023-24 period, how important it is for people to be vaccinated. With the new requirements now, it's going to be anybody or the new recommendations, and really anybody 6 months and older, really we recommend be vaccinated. We can go to the next slide. I know, Justin, do you want me to cover one more? I can go ahead and cover this one.
Let's briefly go over this, and then just to let folks know too, after Matthias leaves, we're going to do a deeper dive about the new vaccine as well. So we'll cover it twice because it is important. But maybe right before this, Matthias, I do have a question in the chat box for you. I'm just going to read it out loud. So, I'm with the Asian Counseling and Referral Service. I have not heard of any vaccine clinics for the AN-HPI community. Is this something that could be set up at our office?
That's a great question. So this is, one of the things that Public Health South King County is still able to do, and the state is also doing, is offering community vaccination events. This is, and the link that is there on kingcounty.gov/vaccine is one of the ways that you can actually request to have a community vaccination event happen at your location. So we are continuing to support those. The state also supports those as well. So yes, please feel free to reach out to us and in public health Elgin County for these. And maybe this is where I can kind of cover, because that's one of the points, right? That the community vaccination events are continuing. There are other ways, of course. The pharmacies is a great way to get your vaccination. Also, you can see there the vaccines.gov, where to find also other places and locations. And we are going to be starting on October 3rd. We have our public health center in Kent is going to be offering vaccination. And this is going to be available, again, for anybody, regardless of insurance status. So it's not at the level, that we had before in terms of, multiple free vaccination sites, but we do have this center in Kent Public Health. And starting on October 3rd, we will have the COVID vaccine available. And then we do offer things. We are continuing to offer, and you can contact, if you're with a social service organization or a health organization, you can contact us in terms of, we do offer for people who are not able to leave their homes. We offer vaccination for those individuals. We also offer vaccination through our Healthcare for the Homeless and other programs for people who are living unhoused. A lot of work happening with our schools and our school-based health centers, so offering vaccination, and not just COVID-19 but for others. And those are free for kids for middle and high school. And again, the community vaccination events, we are offering them. We also, I think, we're going to be moving close to be able to offer other vaccines too. I think right now our community vaccination events don't necessarily have like the flu vaccine, but I think plans are in place to be able to offer other vaccines as well. I'll just add, in terms of vaccination, it is okay to get both a COVID-19 vaccine and the flu vaccine at the same time. So if that is an option for you, that's a great way to proceed. So with that, I'll return it back to you. And I think David from ACRS, hopefully, it seems like we answered your question. So thanks for that great question.
Yeah, thank you, Matthias. We have about 2 more minutes, potentially, just to see if there's any last minute questions for Matthias here before we kind of go over some more in-depth stuff. We'll pause for a second. Well, I am not seeing anything, Matthias. I appreciate you as always for being here and taking the time. If there are any questions that come up throughout this meeting, I will push them your way, my friend, and we can hear back next meeting.
Right. Thanks, everybody. Take care. Stay healthy.
Yeah, thank you. All right, folks, thank you again for joining us here. Like I said a little bit ago, we're kind of going to dive into some of the same things that Matthias just briefly went over. Let's make sure I'm on this right thing. All right. So we're going to kind of want to talk about, the new COVID-19 vaccine for 2023 and 2024. I got to minimize this, move this completely out of the way. All right. So just to remind folks again, so, vaccines, preventable infections, COVID-19, annual boosters. So they are made available typically in the fall. We have seen this around many types of boosters in the past, and now we're seeing it again with this new COVID booster. So these boosters, they allow for updates based on the circulating current variants, and the boosters will provide, extra immunity, protection, especially those at the highest risks for severe disease. All right. So anytime throughout this, please don't hesitate to jump on in and ask a question, or if there's anything in the chat box that I'm not seeing, please make sure I get that answer. But a new COVID-19 vaccine was approved to protect everyone this fall and winter. So as kind of we heard from Matthias, everyone, 6 months and older should be able to get the updated 2023, 2024 COVID-19 vaccine. Again, this is going to be especially important for those older adults and people with high risk conditions. So the new COVID-19 vaccine is worth getting, even if you've been vaccinated before or you've definitely had COVID. So what this is going to do, especially with this new round that we just got approved, it's going to strengthen your body's ability to fight the new variants of COVID-19 that are spreading right now. Currently, folks have been hearing about this EK.5 new variant, which makes up about a landscape of 22% of the national cases. We're going to kind of talk about that a little bit later. And also, various other Omicron or the Kraken variants that we've kind of had in the beginning of 2023 leading up to where we are. So studies show, that staying up to date with COVID-19 vaccines, is going to protect us from long COVID. It will protect us, from getting seriously sick, prevent us from hospitalizations. But if we talk about long COVID, just to kind of remind folks, long COVID includes, those long lasting symptoms like difficulty with thinking or breathing, bad headaches, or extreme tiredness. So anyone can get long COVID, even if you aren't in a high risk group. So the new vaccine is aimed at kind of protecting everyone, and it's definitely aimed at protecting you from that long COVID, which we've, have all heard stories from. All right. So for COVID-19 vaccination appointments, we're asking folks to check, vaccines.gov. So there you're going to find pharmacies and clinics that have the new COVID-19 vaccine. Some pharmacies and clinics will have the new vaccine in the coming days. Many will not have appointments for another week or two, but eventually there's going to be plenty of appointments. But definitely, head over to that vaccines.gov website, as not every pharmacy right now is going to have that stock of the new COVID-19 vaccine for, the current fall 2023-24 that we are currently in. And as Matthias kind of pointed out, starting October 3rd, Public Health will offer the new COVID-19 vaccine at the Kent Public Health Center. So for folks that are familiar, the Kent Public Health Center was utilized heavily throughout the beginning of the pandemic. It was one of our mass vaccination sites. We've had a lot of great success there. There's ample amount of parking. It's a good connector in between South and North King County. But what will public health also offer in terms of vaccines? So we have in-home vaccinations. So these were very useful during the pandemic as well. So, for folks that have an injury, a disability, or a health condition that makes it, difficult to leave the home. So starting in early October, we will be sending out email blasts, kind of in the bulletin that we do, letting folks know how they can qualify or schedule an in-home vaccination site. And as always, we are continuing to have lots of community vaccination events. You can find these on our kingcounty.gov vaccine site. It has a list of the community vaccination events there. And because we are all in this meeting right now together, if there is anyone here who is hosting a vaccination site, a health fair, this is a good space, to network and share kind of what's going on in the community. I implore folks to please reach out in the chat box so that we can, keep community in the know, or definitely send me or Genome an email letting us know we can help promote that event. If it's around, social determinants of health or COVID-19 vaccines and stuff like that. And then lastly, as well, on October 3rd, the free flu shots when you get a COVID vaccine will happen at the public health centers, definitely at the Kent Public Health Center. It leads with COVID first, but they will have flu shots available as well. So I know last year the flu shots were kind of tricky to get at times, but moving forward, they will be at the Kent Public Health Center along with your updated COVID shot that just got released. And I've promoted this, but I'll promote it one more time. kingcounty.gov/vaccines. And if folks have been to our websites recently, you will notice that we incorporated Google Translate in our websites, which have a plethora of different languages. So Google Translate is now on all of our kingcounty.com websites, which makes it just a little bit more accessible for in-language needs. All right. Maybe I'll pause here for a quick minute. Janelle, I'm not sure how we're looking. If there's anything in the chat, or perhaps folks have any questions before we keep moving on.
Nothing in the chat.
Beautiful. All right. So the cost of the new COVID-19 vaccine, if you have insurance. So most insurance is going to pay for the whole cost of the new COVID-19 vaccine. This includes Medicare, Medicaid, CHIP, which is also known as Apple Health here in Washington State. You will need to get vaccinated by a provider in your insurance network. For example, if you have Kaiser, getting your vaccine at a Kaiser location. Vaccine locations will ask if you have insurance. And remember to have your insurance information when you make an appointment and when you go to get vaccinated. So just because a vaccine location is asking if you have insurance does not mean you will get billed for that. It is just good to know with your insurance if the COVID vaccine is free. And if it is free, feel free to give your insurance information to wherever you're getting the vaccine, because they have to just bill someone. You will not incur a cost, but they just like to know that information. Also, you are welcome to not give that information and you'll still get the vaccine if you are in one of our public health settings like Kent that we just talked about on October 3rd. All right. So you can get the free COVID-19 vaccination if you're underinsured or your insurance doesn't cover the vaccine. So free vaccinations are available from the Bridge Access Program, and these locations include CVS's, Walgreens, and some independent pharmacies, community health centers, Public Health Kent's Vaccination Center. And again, to find locations participating in this Bridge Access Program, you want to go to vaccines.gov. Kind of want to do a brief overview of what the Bridge Access Program is for folks. When we ended the declaration of COVID-19, I think it was May of 2023, we were moving towards a at cost for COVID vaccines, COVID tests, and COVID antiviral medication. With the idea that once, we have this large stockpile of COVID vaccines run out at the end of summer, we're going to be moving to a public market where we're going to see a price secured for a COVID-19 vaccine or, COVID test. So what this Bridge Access Program is aimed to do is it's aimed to, once the Federal Reserve runs out, it's aimed to get people access still to that COVID-19 vaccine for free for an extended period of time. I don't know the exact time length of the Bridge Access Program, but it will definitely take us into the new year, which is great right now as we come up with these new COVID-19 vaccines here in the fall. So for folks that have insurance, your COVID vaccine will be free. And for folks, who are underinsured or insurance doesn't cover this vaccine, you're still able to access free COVID-19 vaccinations. Again, CVS, Walgreens, some independent pharmacies, community health centers, and the Kent Vaccination Center. But all this information, and when you search for it on vaccines.gov, it will tell you if this location, for instance, like if you type in CVS in downtown Seattle, they participate in the Bridge Access Program. If you are going to Othello Health Clinic, it's going to tell you that they perhaps are part of the Bridge Access Program. I don't have a list of who is participating yet, but I think that is a good idea moving forward to kind of find out who these independent pharmacies are for folks. All right. So children and teens who don't have insurance can get free vaccinations. So providers in the Vaccines for Children program, school-based health centers in many schools in King County, back-to-school vaccination clinics in South King County, you can get COVID-19 vaccines and all childhood vaccines required by school at these back-to-school vaccination clinics. And here, once we send this bulletin out with this PowerPoint, you'll have all these links. But information about these options, you want to find a vaccination provider for underinsured children, and then you want to hit find a clinic, and you'll have a lot of translated information available of how to access that. And just a reminder again, in the state of Washington, anyone who is 18 years or younger, vaccinations for back to school and COVID-19 vaccinations will always remain free. So if you're 18 years, 17, so on, up until 6 months, that COVID-19 vaccine is definitely going to be free at no cost, whether you have insurance or you don't have insurance. A lot of the talk right now, because school just started, we have the back to school vaccination clinics. I know we've been messaging a lot of it in our bulletins around how to access those vaccination clinics. But if you go to the kingcounty.gov/find a clinic, you're going to have a list of children and teens vaccination clinics for you on that page. Any questions from this point? I feel like I might be going a wee bit fast here, so I do apologize. All right, moving on. Okay, so help your body fight the new variants. Get the new COVID-19 vaccine, even if you've been vaccinated or you have had COVID or recently had COVID. So you should get the new vaccine if it's been 2 months or more since you got the last COVID-19 vaccine. So what are we at right now? September 20th. We're dating back to July 20th. Anytime you got that COVID-19 vaccine, that last round of the updated booster prior to July 20th, you are eligible now, to get the new updated COVID-19 vaccine. And again, this vaccine is aimed almost like a booster, which is really tackling a lot of those last variants that we saw the end of 2022 and the beginning of 2023. So if you haven't received a recent vaccine or booster, updated booster in the last 2 months, this is a good time right here in the fall to get that new updated or get that new COVID-19 vaccine rather. So get the new vaccine if you've missed getting a booster earlier or if you've never been vaccinated. So if you've had COVID recently, you can get the COVID-19 vaccine once you've recovered. So as Matthias said, this will be the new COVID-19 vaccine moving forward. The previous versions, that we've used in the past, first dose, second dose, booster, updated booster, so on and so forth. They've stopped manufacturing those. We are now going to be focusing on this COVID-19 vaccine moving forward. So if you or your community, is just starting this process of getting their first dose and second dose, this is going to be the vaccine moving forward that they will be getting as a first dose, second dose. But for folks who've already gone through, those steps of getting their first dose, second dose, perhaps they've gotten a booster, perhaps if you've got another booster on top of that, maybe they're at shot number 5. We'll be getting this COVID-19 vaccine. So that is going to be the new one moving forward for all of us. All right. And this is a common question, and I know Matthias talked about it, but is it safe to get the COVID shot and the flu shot at the same time? So the simple answer is yes. If you want to avoid separate appointments for vaccinations, you can get the shots at the same time. And again, starting on October 3rd, potentially, I don't have an exact date here, but you can get a flu shot when you go to the Kent, Health Center, the same time you're getting that COVID-19 vaccine. Again, you just want to listen to your body. You know your body best. If you historically have gotten the flu shot in the past and it just, makes you super tired, wipes you out, might not work best for you to get them both at the same time. Maybe you want to get them both at the same time so you can just feel super fatigued. Maybe you don't feel any of those symptoms after getting a shot and, might as well just do it all at once. So you kind of know what your body is up to, how you kind of dealt with things in the past. But if your only question is, can I do this? The answer would be yes. You can definitely get the flu shot and the COVID-19 vaccine at the same time. Yeah, and I do see a question in the chat box. So I'm going to read it out loud here. If I've recovered from COVID last week, am I free to get the vaccine now? So no waiting a few months like we used to do. Yeah, so that is a great question. So if you've had your booster, your COVID-19 last shot, 2 months ago, and you just got through COVID, first things I would talk to your primary care doctor, talk to a healthcare professional. Everybody's body is a little bit different, but I would give it at least, a 2-week waiting period since you've recovered. And then, you'll be able to get that updated booster or that new COVID-19 vaccine rather. But again, really want to stress that if you just had COVID, you're in recovery mode, reach out to a doctor if you have one, because they're going to have, some of the best answers for who you are as a person moving forward. But generally, if you've had the latest shot 2 months prior and you just recovered through COVID, give it that 2-week grace period before, get that new COVID shot. So hope that answers your question. If not, feel free to come on mute and I can. Oh, beautiful. All right. Let's see, where are we at? All right, so that kind of wraps up a little bit about the new COVID-19 vaccine. Again, we will be sending these all out probably some point next week. We'll attach the PowerPoint to the newsletter that we send out. But if you have any questions about the new vaccine, don't hesitate to reach out to Genome, myself, or anyone here at Public Health. But we're also encouraging folks, to call the Washington State Department of Health, the DOH. They have an information line, 1-800-525-0127. Say the name of the language you use for interpretation. They're going to be able to answer some questions for you about the new COVID-19 vaccine. And you can also go to our website, kingcounty.gov/COVID/vaccine, and they're going to have more resources there. Some other websites that I use as well, the vaccine.gov has a lot of great resources. The CDC or the World Health Organization are all great places to keep up to date. But definitely, please utilize this space. Please utilize me. Yeah.
Justin, question in the chat. Are flu shots at King County Public Health Center in Kent free to uninsured folks too?
Yeah, that is a great question. So in Kent at the health center, they will be. I need to get a little bit more details because I think it is my understanding that the flu shots are available, but it is going to be available for folks who also got the COVID-19 vaccine. Not sure if there's anyone from public health who has a more definitive answer of how that is going to work once they're in Kent, but I believe they will be of no cost for folks at the Kent Health Center. But my only question that I don't know the answer to is if you can get the flu shot as a standalone, or if you need to get the flu shot along with the COVID-19 vaccine. That's the part that I'm a little unsure of at the moment. I know they will be offering them, but who asked that? Because I can definitely get back to you. Yeah, so Brenda, I think, once we get a little bit more clarity of what that's going to look like, we can circle back and definitely write that in our bulletin moving forward. But anything at the Kent Public Health Center is going to have no cost to it. COVID-19 or flu, just a little unsure of how that flu is going to work if it's just going to be a standalone. But good question, though. All right. So if you've been in this space before, this is a slide you've seen, but it's always good to go over. So are the COVID vaccine doses for kids the same as for adults? And the answer to that is no. I'm going to kind of go through just the dosages for children, and then you'll kind of see them what they look like for adults as well. So for the Pfizer vaccine, children under the age of 5, they receive 3 microgram doses. Children 5 to 11 are going to receive 2 10 microgram doses, and then children 12 and up, so 12 up until an adult, you're going to see 2 30 microgram doses. So you just see that the variation in doses that you're getting versus on your age group. And Moderna is kind of the same. So under the age of 6 to 25 microgram, 6 to 12 to 50 microgram, And, children 12 up until adults are going to receive 2 100-gram doses. So just, I like to kind of see this to know what's going in, a child's body and so on and so forth. Yeah, and I got a private message. So the question is, are we starting to see vaccines in the community? Example, pharmacies. And that is a good question. And just to kind of touch upon that again, as of right now, you will see some pharmacies in community have the new COVID-19 vaccine. You want to go to vaccines.gov. I'll type it in the chat, or maybe Genome, if you also could maybe drop the link.
I'll get it in there.
Okay, awesome. Yeah, you want to go to vaccines.gov, search, I think, by your zip code, and it's going to tell you which pharmacies around you have the new COVID-19 vaccine. Very limited right now but in the next week, 2 weeks, and definitely in the next 2 weeks, we're going to see, almost all the pharmacies have that new COVID-19 vaccine in stock. So short answer is yes, we're starting to see vaccines in communities. Just not everyone right now. It's a little bit of a slow process getting that out. And thank you for dropping that link. All right, so variants, right? So kind of why we have that booster in the fall time. So why do we have different COVID variants? Viruses, they're always changing. The more a virus spreads, the more it changes, or some folks like to call it mutating. When a big change happens, the scientists, they call that a new variant. So some variants are less harmful, while others are dangerous. And the scientists, they're concerned about variants that are easier to catch and spread to others, or that cause more severe illness. We saw that with the Delta variant, saw that with the Omicron variant. Those were 2 variants that really were definitely easier to catch, and they spread and they caused severe illness. A variant that didn't spread as much, we definitely talked about it at the beginning, was the Kraken variant around COVID. There were a lot of cases in the very, very beginning, and then it kind of dissipated. And again, we'll talk about the newest one coming up, but that's kind of just why we have different variants. And all these things combined, again, what leads us up to that booster that we see in the fall, as we will see next fall and year after year, is as the virus mutates, we have these variants throughout the year, leads us up to fall where they make a new vaccine that kind of encaptures different variants, to build up that immunity moving forward. All right. So we talked about this a bit, and I apologize. This is going to be the shortest, cutest little slide, but is the new COVID variant EG.5 spreading in King County? So we're watching, obviously, all the COVID variants, but we don't have the same level of local data about variants as we did, in the height of the pandemic. So as of September 2023, the CDC is reporting that the newest variant, which is called at this point EG.5, it makes up about 22% of national COVID cases. Again, that is a very national lens. And at that rate, and that has been, the rate that it has been increasing. So we don't yet know how much this variant is contributing to the increase in COVID metrics locally. And that's kind of all the information that we have at the moment. Once a new variant, kind of gets noticed, it takes a little bit of time to collect some data. So the only thing we kind of have to look on right now is the CDC. And if you go to the CDC's website, they have a new interactive way to kind of look at different variants around COVID. They have a long list of each COVID variant on there. And right now, in August, September, and up to current day, we are in September, you can see which variant is running hotter, which is the top variant right now, and it is the EG.5. Again, that is on a national level, so we're waiting to hear from our local doctors here and local scientists here of kind of what that means for King County. And I think that we can look at it in a couple ways, right? So we've started school again. Summer has ended. A lot of kids are back in school. We have this potential new variant, um, and we're seeing an uptick in case counts. We're still relatively low, but we are seeing an uptick. Will be it small, it's still just a little bit cause for concern, but we just don't have the most up-to-date information, and I'm sorry that I cannot provide any more on that. But does anyone have any questions about the new variant? I might not have the answer, but I'd be very interested to hear people's questions so that we can, send it to Dr. Eric Chow and maybe he can answer them for us. Sweet. All right. So again, another slide that we've seen, but staying protected against new variants. And this is also staying, protected against COVID. This is staying protected against the flu. This is staying protected against colds. But the best way to protect yourself, and on the screen, you're going to see XBB, which is the Kraken variant. I didn't update it. But the best way to protect yourself, even now with the new EG.5 subvariant of Omicron, is to get vaccinated and stay up to date on those COVID-19 vaccines. So it's a great time right now, especially as we have that new COVID-19 vaccine that just got approved, to get updated, maybe to get your first dose, second dose, get a booster, get that new shot, get updated right now. Most insurances are paying. If your insurance, you're underinsured, is not covering that COVID-19 vaccine, we have that bridge access program. So that vaccine is still going to be free. That is definitely the best way that we're going to be able to protect you and definitely your community and loved ones around you. Always want you all to just assess your risk level and keep that in mind. So when it comes to being around other people, sitting indoors, especially as we enter, the fall and the winter months, a lot more things are indoors. Wearing a mask is definitely part of safety. Not just any mask, one that works with your body. Consider wearing an N95 for the best protection. But you'll notice, not everyone's wearing masks. This is definitely just at this point a personal decision that you make. I walk around with a mask quite a bit if I'm in public. So that's definitely a recommendation. And then just some other simple things, avoid those poorly ventilated spaces, maintain your physical distancing. If you feel sick, stay home, get tested, and then, from there you can determine the best course of action for you as well. But it's tough right now. So we still have, our COVID test. And what we've seen with the COVID testing is folks are still getting COVID and they're not reporting it, to the Department of Health. So because of that, we don't have an accurate understanding of where kind of our case count is here in the county. But nonetheless, we'll touch upon that in a second. But I kind of want to talk quickly about COVID-19 tests. So as of right now, COVID tests are available at pharmacies for a cost. They range from $10 to $25 a box. Doctors' offices, pharmacies. You can check with your healthcare, with your health insurance to see if what your out-of-pocket costs are going to be for a COVID-19 test. Many health plans, offer free or low cost access to tests. Organizations, CBOs out there, they have most of them are probably going to have access to some COVID tests as well, that you can get your hands on. And if you are an organization and you need an at-home COVID test, please reach out to the email that you see on here at p8partnerships@kingcounty.gov. Reach out to myself, reach out to Genome as well, because we have a link that we can send you. We still have at-home COVID tests available. And another thing with COVID-19 tests that you'll notice is some of them may be expired. And a great way, because the federal government has pushed those expiration dates back, but once it's printed on a box, there's not much we can do. But a great way to test that those COVID tests are still up and running is when you drop the solution in that little tester thing. If if no bars show up, it's completely blank and there's solution in there. That's a good way to tell that your COVID test, has expired. If you are seeing one line, it's still active. Obviously, if you see two lines, that person or you perhaps has COVID. But if 0 lines are popping up when you put that solution in, throw that test out. Let's get a new one. Let's check it again. And then lastly, I briefly saw this pop up in the chat box, but that is correct. I think today the news article broke. The federal government is opening up their COVID test portals again. I believe they allocated something like $600 million to kind of start that program up again. This comment in the chat box says sending 4 more free tests starting Monday. So that is great. I guess once that link goes live, I haven't clicked on the article, so I don't know specifics. But if it's anything like the program that we had last time, you would in your household could order up to 2 or perhaps 4 and get those. And yes, if they've the tests that you get from the federal government or any organization or even your local pharmacy, if they're expired, those dates have definitely been extended. So good news for folks. But to sum a little things up again, if you are an organization, a CBO, you need to get your hands on some at-home COVID tests, please reach out. We can send you a link and we can get that ordered and delivered to you. So just kind of wanted to end on there. All right. And then we're kind of nearing the end here, but just to go over some of the stuff that Matthias said earlier as well. So generally, COVID-19 burden in King County is decreasing. We've seen this. And when we say that, I mean, like, we're decreasing from the levels that we were in the height of the pandemic. We generally have a great handle on it here in King County. Nationally, globally, not so much, but here in King County, we've done a good job of getting community vaccinated, getting community up to date. A little more work to do, obviously, around this new vaccine, but our case counts are still relatively low. And the problem is when you look at data, like you're looking on the screen right now, you're going to see that uptick and it's going to look aggressive. But that's just the trend that we're in right now. We're working a little bit up. But I can safely say that we still got a pretty good handle. If we see that continuously climbing, then it'll be a different story. But King County, and from the help of everyone involved, everyone here on this call, have done a great job of, keeping community safe and vaccinated and keeping our loved ones where they need to be. Just another trend of kind of the same message that Matthias showed, which goes over some numbers that I'm not going to dive into. But this one, I always love this one. So just to keep in mind too, if you're sick and you test yourself from COVID, we want that information to get back to public health if you're positive. And by doing so, we need to submit your test results to the Department of Health. If you're sick, if you're negative, we don't need to hear that. But what is happening is, folks are testing, right? They're not sending that information into the Department of Health. That information is not getting back to King County or Public Health. We don't have a good idea of kind of the levels of transmission or the folks that are positive with COVID in our county. So Public Health receives the data from people who seek out testing. The case counts become a little bit less reliable. And what ends up happening is we turn to hospitalizations and death data for disease burden. Just the nature of the game currently where we are right now. It's very convenient to test at home. But if we can just keep up with the messaging, if you do test positive, we can just, let the DOH know, Department of Health know that you have a positive test. Then we can, just get a little bit more accurate of data. It's a hard reach, I understand, but I don't know, I'll kind of leave that there. All right, so kind of think we just went over this, but COVID-19 vaccinations remain a key part of public health interventions. Getting vaccinated, especially with this new one that has just been released, it's going to lower the hospitalizations. It definitely lowers the death. And with this new vaccine, we're lowering the long COVID as well. This is a great time. This is a perfect time for the meeting. I'm very happy that we got that bridge access program as well. So a lot of things are kind of looking on the up and up right now around COVID. All right, how do I change this? This one is done. All right. Well, that was it. I appreciate you all. Let's give it maybe 2 minutes, see if anyone has any questions. Today, we really heavily talked about COVID-19. I know a couple of the last meetings, we've incorporated some other public health stuff in there, but we really just wanted to talk about the vaccine and kind of where we're looking here in the county, because it's been about 2 months since we've been with you all. Yeah, so Gloria, how are the infection rates in the county? I hear there are many infected. So, I mean, I feel like I would as well. I've heard the same as you. I feel like I could say I know so many people that have COVID. But if we look at the numbers, we're on a little bit of an uptick. We have, let me bring up that screen again. So reported COVID-19 cases for 100,000, we're looking at, 38.9. Hospitalizations due to COVID-19, 2.7. But again, we just need to remember that even though as we may feel that there's a lot of people with COVID, because that information isn't getting back to us, our case counts are going to be on the lower end here at Public Health. But we all work in community and know that that's not necessarily realistic. We have many friends and family members and school children right now who have COVID. So it's a little bit unreliable, but those are the numbers that were on King County's website for the information that we have. But I would agree with you, Gloria. I feel like a lot of people do have COVID right now. That's why we just got to keep up with the messaging around this new vaccine that is coming out. We can couple it with the flu vaccine as well. And on a personal, if it feels right for you to wear that mask, please do. Social distance, keep up with your washing of the hands. And if you're sick, stay home. Take care of yourself. If you need at-home COVID tests, please reach out to myself or Genome. We'll get you covered there. Yeah, any other questions, team? Our next meeting is, let's see. I believe it is going to be on October 18th. Don't quote me, but I'll put that in the bulletin. And for folks, I keep talking about this bulletin. It's a new thing that we did about 3 months ago. I hope it's working out for you all. If you're not on that distribution list for the bulletin, please send me a private message with your email and we could add you. If you are and you have any suggestions of how we can better it, always open to that as well. But I think we can wrap this up. I will stick around for a couple more questions, but I appreciate you all being here. And I appreciate the help from all the interpreters today, my colleague Genome, Matthias for stopping by earlier. So everyone involved with this call and everyone here, thank you very much.
If next month is the third Wednesday, it would be October 18th indeed.
Okay, thanks, Ellen. Yeah, let me see on my calendar.
Wednesday, the next month would be October 18th.
Yeah, so October 18th, folks, 3:30 to 5 p.m.
Okay, thank you.
Thanks, Alan.
Okay, thank you.
Yeah, thanks, everybody. Have a good rest of your Wednesday.
Bye-bye.
Thanks, everyone.
Yeah.
Take care, everyone.
Bye, everyone.
Bye now. Thank you, Claudia. Thank you, Etienne. Thank you, Mashida. Thank you, Haji. Thank you, Antonio. Thank you, Jay.
Bye, bye.
Bye, Marie Rose. Yep, give Cheryl some love when you see her. All right.
I'll give her a cyber hug for you.
Yeah, please do.
Will
Thank you,
do.
Jay. All right. Take care, everyone.